Medicare Advantage plans, please just don't. Okay, that statement may not be entirely fair. Like everything, there are good plans and bad plans, and Medicare Advantage plans remain extremely popular despite their many drawbacks. And maybe take this with an extra grain of salt if you live in Florida, because Medicare Advantage definitely doesn't have the same negative reputation in Florida as it does in the rest of the United States. But you should be aware that more and more hospitals and health systems are dropping Medicare Advantage entirely. Now, I want to be clear and 100% transparent. It's not that we don't enroll our clients in Medicare Advantage plans. We absolutely do. It's just that many people tend to be pushy about Medicare Advantage because of all those additional added benefits, and we like to really discuss the pros and cons. And most of our clients opt for Medicare supplement plans instead. So many people choose Medicare Advantage plans because they're much more heavily marketed and they have those additional benefits. And of course, people are going to focus on those additional benefits as opposed to things like this, which your Medicare Advantage plan definitely won't be telling you about. Now, many different organizations have reported this, but a survey recently came out for the Hospital CFO report indicating that even though it's reported that over half of seniors have enrolled in a Medicare Advantage plan, many hospitals and health systems are considering dropping Medicare Advantage plans entirely. This is largely because of administrative challenges, largely to do with denials of pre-authorization. That's so important, and we're going to talk about that in just a second. And of course, just being slow to be paid. This issue of pre-authorization is huge, and it's one of the many reasons that we might advise against a Medicare Advantage plan for our clients. So Medicare Advantage plans are managed care plans. And yes, they offer HMOs and PPOs, and PPOs are going to give you more flexibility. You won't need a referral to see a specialist with a PPO. However, you still have this issue of pre-authorization. So even if your doctor recommends a specific test or treatment for your condition, your health insurance carrier has to approve it as well. So this can mean a lot of extra paperwork, a lot of extra follow-up phone calls, headaches, and possibly denials or scary big bills, which is the last thing you need when you're already in a medical crisis. And this is very often when we hear from people panicking and wanting to switch to a different type of plan. A recent survey of 135 health systems found that 16% have decided to stop accepting one or more Medicare Advantage plans, and 45% are at the very least considering it, even though they haven't made their final decision yet. And this could absolutely be your plan. The study also indicated that 62% of health system CFOs indicated that it has become significantly more difficult to contract with Medicare Advantage plans than it was even 2 years ago. So that means it's getting progressively worse, and we expect it to get progressively worse in the future. Now, even though some of these carriers and plans that are being dropped offer Medicare supplement plans, those supplement plans will not be affected by this the same way Medicare Advantage plans are. And that's because these two types of health insurance plans are really entirely different. We're going to talk about that later in the video. So one of the big problems with Medicare Advantage plans is that your provider or hospital can just leave at any time. You may have just signed up and in January they're gone because they don't like dealing with that Medicare Advantage plan. Now, does that mean that you can switch? No, it doesn't. Unfortunately, you're stuck with that plan for the remainder of the year. Unless, of course, your Medicare Advantage plan completely moves out of your area. And if that's happened to you, let us know in the comments below, because then you do have some options. Now, if this happens, it can affect everything. Lab work, diagnostic services, urgent care, hospital care, specialists, you name it. A brief pause here to remind you that if you like what you're seeing, make sure to like and subscribe, and you can reach us in the comments or at the number on the screen with any questions. There is, of course, no charge for our services. All right, back to it. There are many different Medicare Advantage plans to choose from, and often people sign up when they first become eligible. As I said earlier, these types of plans are heavily marketed, and it's easy to see why they can be so very appealing. They often offer additional benefits not offered by original Medicare, things like dental, vision, hearing, and prescription drugs, and many of these plans do so at absolutely no additional charge. You just need to continue to pay for your Part B. And these types of basic, premium-free Medicare Advantage plans can be great when you have limited health needs. However, at some point, we all have more extensive health needs, and at that point, many people find out that their Medicare Advantage plan just isn't cutting it. So somewhere in your late 60s or early 70s, when you do realize that maybe you have more extensive health needs and that premium-free Medicare Advantage plan wasn't all it was cracked up to be, You want to make the switch back to original Medicare and add a Medicare supplement plan. Well, guess what? In most states, once you pass that initial 6-month window, which is the 6 months after you enroll in Medicare Part B and turn 65, then you may be subject to medical underwriting. That means you could be charged more or denied for a Medicare supplement plan based on your health. And of course, this stinks because it's right when you need it the most. Now, you can definitely switch back to original Medicare alone. However, there may be some large costs associated if you have extensive medical needs. This page on Medicare.gov will break down the costs associated with Part A and Part B as well. So as I mentioned, for the premium for Part A, it is $0 for most people. If you haven't met that 40 quarters yet, then you'd either pay $278 per month if you've worked between 30 and 39 quarters, or $505 per month if you've worked less than 30 quarters. Then there is the deductible and copays and coinsurance. So for Part A, the deductible in 2024 is $1,632. Now this is applied per benefit period, which you can really think of it like per hospital stay and 60 days thereafter. So if you were to be hospitalized more than once in a given year and you're in a new benefit period, then you would actually have to meet that deductible more than once. Then there's coinsurance and copays for your actual care. Inpatient stay in a hospital, days 1 through 60, no charge. But after that, those charges are rather significant. Same thing with skilled nursing facility care. And then there's home health care and hospice care as well. If we scroll down to Part B, it's a little bit easier to understand. There is a premium, but that is determined by your income. Your deductible is a once annual deductible, $240 in 2024. Once you've met that deductible, you'll be responsible for coinsurance or copays, and pretty much across the board, it's going to be 20% of the Medicare approved amount. This is why so many people opt for a Medicare supplement plan, also known as a Medigap plan, in the first place. And there are 10 different plans with varying levels of coverage and varying price points. So here are the 10 Medigap plans available. Plan A, B, C, D, F, G, K, L, M, and N. And this chart just details what benefits are offered by which plan. Now remember, Medigap plans aren't going to offer additional benefits that aren't already offered by Original Medicare. For example, Original Medicare doesn't offer dental benefits, so you're not going to see that any of these plans offer dental benefits. Instead, what they're going to do is help to cover or possibly entirely cover copays, coinsurance, and deductibles. So basically, you pay a little bit extra, but almost all of your out-of-pocket expenses, or possibly all of your out-of-pocket expenses, will be taken care of. So you can see that all of the plans will cover your Part A coinsurance, which is extremely helpful. All the plans will cover in some capacity Part B coinsurance or copays. Plans K and L are known as cost-sharing plans. So basically, they're going to contribute to these out-of-pocket costs, but Plan K will cover 50% of your cost, and Plan L will cover 75%, and that's just pretty much generally speaking across the board. All the plans will cover the first 3 pints of blood in case of need of transfusion. Part A, hospice care, coinsurance or copays, that's very important. Skilled nursing facility care coinsurance, again, very, very important. The only plans that don't offer that is Plan A and Plan B. Your Part A deductible, that's that deductible that's applied per benefit period. So if you do need to be hospitalized more than once in a given year, then you might have to meet that deductible again, and that can certainly be very expensive. The Part B deductible, no plans that are offered to new enrollees are going to cover that Part B deductible, but that's a once annual deductible and it's not very expensive, so it's not your biggest concern. Part B excess charges. So basically, if your doctor accepts Original Medicare, then they accept the amount that Medicare is willing to pay out. However, they can choose to charge an excess charge, which is up to 15% more. Now, I wouldn't necessarily worry about these because they're not all that common and they're not even permissible in all states. The only plans that do cover Part B excess charges are plans F and G. Plan F is one of those plans that's not offered to new enrollees, but if you are looking for the most comprehensive coverage available to everyone, then that would be Plan G. Foreign travel, almost all plans will cover that in some capacity, 80%. And then there's this out-of-pocket limit. You'll see it's asterisked here because it's not really applicable. For example, Plan F and Plan G, and even to an extent Plan N, are really going to cover all of your out-of-pocket expenses except for possibly that Part be deductible. Plans K and Plan L, because they are the cost-sharing plans, they do have an out-of-pocket maximum, which is very helpful because if you do have major medical bills, original Medicare doesn't have any type of limit or threshold on what your spending could be. So what is the difference between Medicare Advantage and Medicare Supplement plans? Medigap plans, aka Medicare Supplement plans, will sometimes impose an out-of-pocket maximum, like in the cases of Plans K and Plan L, although many of the plans really don't need an out-of-pocket maximum because so many of the out-of-pocket costs are covered. Medicare Advantage plans will always impose an out-of-pocket maximum. For Medicare Supplement plans, there may be medical underwriting depending upon when you enroll and what state you live in. With Medicare Advantage plan, there is no medical underwriting ever. With Medicare Supplement plans, the costs, i.e. the benefits, are standardized, so Plan G will remain the same Plan G regardless of who your carrier is. And that's not the case with Medicare Advantage plans, although they often will offer lower deductibles, copays, and coinsurance when compared directly with original Medicare. Now, no additional benefits are offered by Medicare Supplement plans. They're really just a financial solution to cover those deductibles and copays and coinsurance. On the flip side, Medicare Advantage plans very often do offer additional benefits like dental, vision, hearing, prescription drugs, and many more. Medigap plans, there are no referrals, so you can go to see any specialist without need for a referral, and there is no pre-authorization. That is, of course, not the case with Medicare Advantage plans. If you have an HMO, you'll definitely need referrals, and there's always that issue of pre-authorization, which is a very big issue. And finally, with Medigap plans, it works regardless of who your carrier is. If your doctor accepts original Medicare, they accept your Medicare Supplement plan. And unfortunately, with Medicare Advantage plans, not only are there networks, but those networks can be extremely restrictive. So if you have decided to go the Medicare Supplement plan, you're probably asking, what's the best plan? Well, the not-so-secret secret is that the best plan available to new beneficiaries is Plan G. It's going to offer you the most comprehensive coverage. If you're unsure whether you want to go a Medicare Supplement plan or with Medicare Advantage, then make sure to check out this video that goes into further detail, sort of comparing and contrasting Medigap versus Medicare Advantage. I'll also put that video about Plan G and Medigap in general. Please make sure to like and subscribe, and if you have questions, you can reach us in the comments or at the number on the screen. We'll see you next time.